Dr. Randy Zuckerman is here now talking about the SSAT Public Policy and Advocacy Panel, and one of the big things that you're discussing is the concept of regionalization. Pros and cons. Let's talk about first some of the concerns that physicians have.
So regionalization is a hard issue. It really represents the dichotomy between patient safety and physician autonomy. And so the real issue from physicians is it's difficult to tell people what they can and can't do. On the other hand, most physicians are interested in good outcomes and patient safety. There are a couple operations where it's really clearly been shown that people who do a lot of a certain thing do it better and patients do better. And so that would be true for a Whipple operation, taking out the head of your pancreas, for an esophagectomy, for a liver resection. But it hasn't been proven for lots and lots of operations. And so for those operations, I think the consensus is pretty clear that they should be done in places where people do a lot of them. It doesn't have to be an academic medical center. There are community hospitals that do lots and lots of these. I'm at one. But on the other hand, it's these other operations that people do that they do well. For example, a colectomy, a cholecystectomy, other abdominal surgery that they've been doing for years that I think there's a perceived threat that those things will be regionalized. And that's of great concern to, I think, a lot of surgeons in the country.
So is there a concerted effort to make sure this regionalization only impacts some of the more complicated procedures, and in that vein physicians can feel a little more comfortable about the ones that they do currently?
It's a great question, and the reality is this is not a new topic. This has been going on for the past 20 years. And so is there a concerted effort? Yes and no. I think there's been a lot of press around this in the last 6 months, both lay press and medical press. People don't know how to do this well yet, though. So how do you regionalize in a way that protects patients and also protects doctors? And when I say protect doctor, that's not from an economic perspective. It's really, if you're practicing at a small hospital in rural America, how do you keep your skills up? How do you handle that tough case in the middle of the night if other things are being sent away, the elective, straightforward things? And so it's really an issue of, how do we staff surgery in America? And how do we make sure that people are well trained and competent and keep their skill sets up if we're forcing regionalization of things that maybe shouldn't be regionalized?
And in talking about regionalization, we're not only talking about between city and city, sometimes we're talking about within an institution itself.
No question. And in fact, this latest round of interest in regionalization came from something called the Volume Pledge, which is really was centered in 3 big academic centers, because in an academic institution, there's one guy who might do 50 Whipples a year and one guy who might do 3. Are they the same? Probably not, right? So it was actually a bold move by these academic centers to say, you know what, we're going to concentrate these complex procedures in the hands of people who do a lot of them and have proven that they're good at them.
But then does that hamper the other people from learning and growing and getting to be able to do these surgeries effectively?
Yes. Now, if you're starting out in your career, there are ways to learn how to do this. You can do fellowships, you can be junior faculty, so there are ways to increase your skill set. If you're 50 and you've done one every 3 years for the last 20 years, probably not the best idea.
And this is not just about patient safety. There's another factor here that comes in, and that is insurance.
Correct.
And there may be some sort of impact there.
Right, and that's not really played out yet, though I imagine it will eventually. So insurers want patients to have safe, good experiences without expensive complications. And I think eventually a lot of what we do will be driven by the payers.
It's an interesting topic that will continue to unfold, I'm sure. Doctor, thank you so much.
Thank you very much for having me.